Welcome to the Regulation podcast from the Institute of Regulation. My name is Marcial Boo, Chair of the Institute and a regulator myself. On this month's podcast, we're talking to two leaders of a specific regulator about its work, the General Medical Council. The GMC dates back to 1858, but underwent reform in the 1970s and again in 2003 to strengthen its governance and independence as a regulator of doctors and latterly physician associates and anaesthesia associates to support good, safe patient care across the UK. And to tell us more, I'm delighted to welcome Charlie Massey and Una Lane. Charlie is the Chief Executive and Registrar at the GMC. He joined from the Department for Health and Social Care, where he was a Director General, having previously worked at the Department for Work and Pensions, the Pensions Regulator, the Treasury, and in Downing Street. Welcome, Charlie.
Thank you, Marcel. Lovely to be here.
And welcome also to Una Lane, who's Director of Registration and Revalidation at the GMC and leads all regulatory work and much else besides. Una's been at the GMC since 2002, having previously spent 8 years at the Legal Services Commission. Welcome to you too, Una.
Thank you very much. Pleasure to be here.
It's great to have you both. Thank you very much for joining. So I briefly introduced the GMC and its work at the beginning, but Charlie, do you want to give us a brief overview of your role there and what you do?
Sure. As you said, Marcial, our purpose overall is to support good, safe patient care. And to do that, we work with doctors, physician associates, anaesthesia associates, patients, and stakeholders. And the law sets out three key functions about the way in which we do that job. We set the standards that doctors need to meet. Secondly, we oversee medical education and training. And thirdly, we investigate where there are concerns about a practice of a registrant. So those are our key functions, and I'm sure we'll talk more about this in the podcast, but we've increasingly sought to direct more of our focus on upstream activities. And by that, I mean trying to support doctors and employers before doctors or PAs or AAs run into trouble.
Okay, that makes a lot of sense. And I know that lots of professional regulators will understand those kind of functions and indeed the need to work upstream, as you say, to make sure the problems don't arise in the first place. So coming to you, Una, as the GMC's regulatory lead, how would you characterize the way you regulate your sector? And in particular, I'm interested in what good regulation looks like for you.
Thanks very much. So Charlie's talked about the nuts and bolts of what we do and the duties and powers that are set out in our legislation. But we do think that how we do that is every bit as important as what we do. We talk and we use three words in relation to our role as a regulator. We talk about being effective, we talk about being relevant, and we talk about being compassionate. I think effective and efficient is what you would expect any regulator or any organisation to do. And that's really important in terms of our day-to-day processes around registration, revalidation, around our oversight of education, and taking action where significant concerns about any member of any of our professions are raised with us. But we also think it's really crucial to stay relevant. We do need to understand the evolving landscape. That's not just in healthcare, but the social, cultural, and technological changes that we all experience. Technology is changing the way healthcare is delivered, the demographics of the workforce, rapidly changing, and career paths and expectations of younger people entering the profession are changing fairly significantly. And finally, I think it's really important for us to be compassionate. I often talk to colleagues about never forgetting our own humanity and the humanity of those that we regulate. So sometimes it can be extremely important for us to be really compassionate in our approach, particularly around our fitness to practice investigations, and recognise that human beings are, like all of us, capable of error, are under pressure, and as Charlie has mentioned earlier, sometimes more in need of support rather than sanction.
That's very interesting. I know that other regulators, the vets regulator, RCVS, also talks about being compassionate. And that's difficult, obviously, in a regulatory context where you're balancing different needs and in fitness practice, as I'm sure you found, you're balancing the needs of patients and doctors. So how do you make manifest your compassion in practical terms?
Shall I start and then perhaps hand over to Charlie?
Yeah, Una, do you want to go?
Yeah, I mean, it's partly about how you deal with people, I think. Absolutely recognising, as I've said, their humanity, that people make mistakes, and that actually sometimes it's really important for us to take an approach that's understanding of the pressures that all healthcare professionals are facing in the NHS and in other healthcare settings more generally. But it isn't just about fitness to practice. I think we need to understand how people's day-to-day lives are like in their working environment. We need to understand what younger professionals particularly are expecting from a work-life balance. We need to understand more about how they expect their careers to progress and what our role in terms of overseeing their undergraduate education, their postgraduate education means in that context. It isn't always perfectly easy to get that balance right. Sometimes regulators are effectively asked to be referees in particular kinds of contexts. But as I said earlier, I think there's something really important about focusing on remembering our own humanity and the humanity of all of those we regulate.
Thanks, Una. And then coming to you then, Charlie, on that point about compassion, but also on the relevance, because I know that lots of regulators do try to stay up to date with technology, but they're also constrained by the legislation that may have been passed many, many years ago. So how do you approach that difficult task of staying up to date?
So it's really important to stay up to date, and indeed it's one of the things we ask of doctors too, that they make sure that they're keeping their practice up to date. And indeed, part of the way in which we do that is through our oversight of their education, both undergraduate education and postgraduate training. Part of us kind of staying up to date is also through the way in which we interrelate with technology and AI, and for doctors, of course, and indeed PAs and AAs, this isn't just about the technical skills of being an accomplished clinician. It's all about those softer skills too. So how doctors and PAs and AAs interact with patients, with each other, particularly given that medicine's an increasingly complex set of activities. It's a team sport. And so keeping up to date is also about those softer professional skills as well.
That's interesting. And you mentioned there PAs and AAs, that's physician associates and anaesthesia associates, that you've recently been asked to regulate as well. And broadening your remit in that way, I know for any regulator is going to be a challenge. So Una, starting with you, how have you gone about doing that, expanding those regulatory responsibilities?
So I think the first thing to say is that we've had quite a bit of time to prepare for this. The government asked us to consider regulating physician associates and anaesthesia associates way back in 2019. But given the COVID pandemic, amongst other things, it was 2024 before the relevant legislation was put in place. So I think in terms of the nuts and bolts of regulation, I mean, it's what we do and what we understand. And so moving to a situation where we're now registering physician associates, anaesthesia associates and doctors, setting their standards, overseeing their education, investigating fitness to practice concerns as appropriate is something in which we have expertise. And we've started that process on the 13th of December when the legislation kicked in. And we've already registered about 3,000 physician associates and anaesthesia associates since the start of the year. It hasn't been without its challenges. If I'm honest, not all doctors are happy about the GMC becoming a multi-professional regulator, and not all doctors are happy about the way physician associates and anaesthesia associates have been deployed in the service in the NHS. But the thing that we really wanted to do is maintain our focus on what we believe the right thing to do was, which was to bring these groups into professional regulation. They'd been working in the NHS for close to 20 years without being regulated. So it was very important for us to get that across the line and maintain our focus.
Well, that sounds like a great bit of work that you're engaged in, and I really wish you well with that challenge. Charlie, on that issue and others, where are the challenges that the GMC is focusing its attention on at the moment?
Well, just in relation to that issue first, I think it's worth just taking a step back and recognise that these are roles that weren't formally regulated. So a regulator stepping in to set standards, to oversee education and training, and and make sure that those registrants are held accountable when things go wrong, I think is a positive step and one that enhances patient safety. And having said that, recognise that some of the reaction from some doctors, not all doctors, in relation to that function reflects the fact that it's very challenging out there in the NHS at the moment. And I think that's sort of my segue really to answer the second part of your question, Marcial, which is that part of the big challenge we face is really about the context in which our registrants work. The NHS is a place where there are enormous challenges in delivering safe patient care. And I think it's really important that those of us working in professional regulators or indeed system regulators are really understanding of that context in the way in which we undertake both our core regulatory functions, but also in the way in which we see our roles in terms of driving wider improvements, for example, in the environments in which doctors, PAs and AAs work. So those are some of the kind of the bigger, wider questions about how we determine and undertake our kind of wider role in what is a very complex system in healthcare.
Yes, indeed. And goodness me, it certainly is a complex system in healthcare. And I know that there are a number of other regulators, both regulators of professions and more systemic regulators that are working in part in England and Wales, and then, of course, in Scotland and Northern Ireland separately. So there are a number of stakeholders I'm sure you're having to engage with. But in my experience, many regulators in sectors other than health are also trying to think more systemically about the way that they think about the environment that they're regulating in terms of systems with complex actors with different interests, and trying to balance all of that is very challenging. So broadening the perspective a little bit to think about the wider health landscape. What do you think that you and other regulators can do to support the maintenance of and improvement of standards in the NHS?
So obviously we need to make sure we're doing our day job well. And I'm very pleased that the GMC has always met the standards of good regulation that our regulator, the Professional Standards Authority, has set for us. But beyond that, I think we all have important roles in terms of understanding and interrogating our data. So that's an area where we've put an enormous amount of focus in recent years to try and use our data to derive insight, either for action by us or to hold the mirror up to the wider system. So just to bring that to life for you, one of the areas which we see in the NHS is that there is too much discrimination, too much inequality in the NHS and the working environment for doctors and other healthcare professionals. So trying to use our data to define the actions that both we and other regulators can take is really important. And the other area I would flag is the importance of using our data to flag risk and where things might be going wrong. Too often, I think, when we look back at problems in our health services across the years, we spot things that perhaps we should have spotted sooner if we'd been joining up more effectively across regulatory boundaries. And I think that question about risk and surveillance and understanding what our data are telling us is really important. And then, of course, the question is how do you then have those conversations in a joined up way? So we work very closely with the other healthcare professional regulators like the Nursing and Midwifery Council, the Healthcare Professions Council, but also the system regulators, so the Care Quality Commission and the other system regulators in Scotland, Wales and Northern Ireland that we work with as well. It's a complex landscape, and I think we often need to reflect on our role individually to join up and make it more accessible for those who don't interact with us on a daily basis, whether that be employers, the professionals that we regulate, or indeed public and the patients who want to tell us about their experiences.
Yeah, I think that's great that you're moving in that direction, because obviously, as we all know, those people on whose behalf we're regulating often don't understand that kind of complexity behind the scenes, and they just want to make sure that their food is safe, or that their trains run on time and they're safe, and that the doctors obviously have appropriate regulation too. So that's great that you're working with those other bodies, and I wish you well with that endeavour. But thinking also about patient perspectives, just sticking with you for a moment, Charlie, sometimes we read of a non-medical behaviour, if I could call it that doctors might take part in, things like they've been convicted for fare evasion or some other malpractice that's not directly medical. Do you think that has any part in your regulatory remit, or should that be something separate?
Well, it does have a role, because fundamentally, the role of a doctor is one that patients need to have trust in, and we need to make sure that we are aware of things that might compromise that trust between doctor and the patient. And what people do in their private lives is relevant to that. But at the same time, regulators need to be proportionate. Our focus needs to be on patient care. And so we would be wrong to push cases unnecessarily, particularly if, for example, they've been looked at in the context of the criminal law or civil law or in other places. So our desire is to really focus on cases which pose a real risk to patient safety and public protection, but also to be conscious of activities and behaviours that might jeopardize the trust that patients need to have in the healthcare professionals that they're working with.
Okay, fantastic. Thank you. And Una, moving back to you, thinking about patient safety, which is obviously at the heart of what you're doing. Charlie talked about working with systems regulators, people like the Care Quality Commission, and I'm sure that you're working with them, including on issues like the working environments in hospitals and in community settings. We've heard, particularly through COVID, of the pressures that doctors are under. You've talked about that already yourselves. What can you do at the GMC to work with others to support clinicians in the difficult jobs that they've got?
Yeah, I think we think that we have quite an important role in that area. And the kind of things we do are twofold, really. One, we can absolutely use our influence with employers or others where there are significant concerns about stress and about burnout. And the second thing I think that Charlie has touched on is the data and insights that we hold, where we can effectively, I guess, hold up a mirror to the NHS and the healthcare sector more generally across the 4 countries. We know from our data and from the surveys that we undertake that there are particular groups of doctors who suffer significantly from stress and burnout. At the moment, that really focuses on those doctors in specialty training and postgraduate training and on GPs as well. And it's important that we make that clear to those who are in workforce planning or who are employers who are actually there on the ground and can do something to address some of those issues. And every year we publish a report called The State of Medical Education and Practice. It has separate data on each of the 4 countries of the UK. And again, it's a real opportunity for people to look at their own individual sites, their own individual areas, and hear really clearly from us about what the doctors are telling us about the significant stress and pressure that they're under. So important for us to use our influence, important for us to use our data and insight, and to continue to emphasising that the care of the professionals that are providing care to patients is significantly important, both for the professionals themselves, but also for the patients that they treat.
Absolutely. And Charlie, do you want to add anything to that?
Well, just to bring some of that to life. So one thing that your listeners may not be aware of is the massive increase in recent years of overseas trained doctors who work in the NHS. So about 140,000 overseas trained doctors are currently working in the UK. And one of the things our data has told us is that doctors from overseas who aren't properly inducted may be more likely to run into trouble with us. So one of the things we've invested in significantly has been our Welcome to UK Practice training. We've had over 50,000 doctors go through that since 2013. But also to raise that question with employers about the working environments to make sure that they are prioritising good induction, not only of overseas trained doctors, but also UK trained doctors as they kind of work in trusts across the UK. So those are the sorts of things that we do think we have an important role in trying to both shine a light, but also provide some support and some evidence of best practice, so that we can help both doctors and employers and indeed PAs and AAs navigate their way through those challenges.
Yeah, great. Okay, well, that's all very interesting, and thank you for explaining all of that. It's great that you're thinking about the needs of your the people that you're registering, as well as the people that they're serving. I just want to come back to the question of data, because Charlie, you talked about how important it was. You mentioned it in the context of identifying discrimination, but also identifying risk. And I know that all regulators, pretty much that I know of, care about having good quality data for precisely those reasons, and understanding the way that their population group is changing over time, and therefore where they can intervene and use their resources effectively. Now, obviously, the technological landscape's evolving very fast, as you've said yourselves. And many regulators are grappling with how best to understand the data that they have access to, particularly now in the light of the AI tools that we all might have available to use. So that presents challenges and opportunities for regulators. How's the GMC preparing for the regulation of doctors working with AI, digital health technologies, and all of those new developments that we're experiencing? Una, shall I come to you first, and I can come back to you, Charlie?
Absolutely can do. I mean, AI is not an area of particular expertise for me. And I think the GMC, like so many other regulators, or indeed so many other organisations, are probably just at the foothills of grappling. What does this all mean for us in reality? We're thinking about it partly in terms of the services that we provide and how AI can have an impact on the kind of skills that people in our organisation will need in the future, what it will mean for administrative tasks, specialist advice, for example. But AI in healthcare and how healthcare professionals will use AI in the future is changing really significantly and rapidly. Of course, we won't be responsible for regulating AI products, but what we will need to do is be prepared to be relevant and move swiftly to provide advice to our registrants about the use of AI, everything from how patients can give appropriate consent when innovative technologies are being used. What is the responsibility of our registrants in terms of decisions that might appear to be made by AI technology, and what this might mean for healthcare in the future. So I think we're probably at the foothills at the moment and just beginning to talk about and grapple with it. But our place, I think, will be around advice and guidance rather than around the actual regulation of AI products per se.
Yeah, that sounds the right way forward to me. Charlie, what's your view on all of these new challenges that are coming down the road?
Well, I agree with everything that Una's said. I mean, it will affect doctors' practice, and so we need to make sure that we see through our responsibilities in overseeing and quality assuring education and training to make sure it's equipping doctors with the skills to work with those changes in technology. But it will also affect the way we regulate, so the way in which people interact with us, and also how we improve our understanding. So we're already using machine learning techniques in terms of extracting insight from the data that I talked about earlier. But as Una said, it's going to raise some questions and challenges for regulators too, and we need to make sure that we are open-minded and equipped with the right capabilities to be able to understand those questions, anticipate them where we can, and work with all of our different stakeholders to find our way through them. But overall, we have to think about AI as being in net terms, a massive opportunity to improve patient care, and that I hope will be the mindset that will guide us through those challenges and issues as we come to them.
That would be fantastic, and I can see intuitively how that must be the case, and that there are challenges for all of us in the regulatory world. And That's one of the reasons why the Institute of Regulation has set up a digital and data special interest group for all regulators to understand a little bit more from each other about how we're approaching these difficult challenges, because it manifests obviously in different sectors in different ways, and there are both challenges and opportunities. So good luck with those, and I encourage anybody listening to participate in the discussions with their peers and other regulators to find out what's working in practice, and obviously to learn from the best that other people are coming up with. So that's clearly one of the challenges that you've got over the next few years, to understand how to incorporate new tools, technological tools, into your work. We've mentioned the remit that you've got and bringing new people into regulation too. So Charlie, coming back to you again, for your vision for the GMC over the next few years, there's clearly a very fast changing landscape, and new things coming along all the time. So what do you think you'd like to focus on, or for the GMC to focus on over the next few years, and how can professional bodies like the Institute of Regulation help you and others?
So in terms of our vision, I think Una encapsulated the three words very well at the beginning. We want to continue to be relevant, compassionate, and effective, and that's going to guide our thinking about our interactions, our processes, our policies, and also doing our day job well. We will continue our focus on addressing inequalities. That's a massive issue in healthcare, and one that I think all regulators need to feel a kind of strong continuing commitment to address. We have, as we've talked about, just taken on the regulation of two new professions. So we do need to embed multi-professional regulation in the GMC. And we also need to play our role in the wider system to improve healthcare, both through a combination of our hard levers, the things that we have direct control of, but also those soft levers, the data, the insight, the influence that we can bring, particularly in a world where there isn't going to be an enormous additional amount of money that we would expect to be injected into healthcare. And to your question about the role of the Institute, I mean, I'd say probably two key things from my perspective. One is to champion the value of regulation. I do think our mindset should be that regulation can drive value. That's a absolutely core part of my belief about the role of the GMC. And I think regulation should be framed as a force for good, not just something that creates burdens and barriers. And secondly, I would really focus on the role that the Institute can play in promoting collaboration. I think we're better when we join up and join forces for wider good. And I think the Institute has a role to play in convening, in sharing insights, and also disseminating best practice.
That's fantastic. Well, I completely agree with that, obviously, Charlie, and I'm very grateful for those wise words. And also, I really wish you well with your fight against discrimination in the health sector, which obviously, as the former chief executive of the Equality and Human Rights Commission, I'm a massive believer in as well. And indeed, it's about enforcing the Equality Act as well. So thank you for that. Can I just finally just come to you both for any brief tips that you would give to people listening to this podcast who work in regulation, and what would you say to them in terms of what to focus on if they want to be a great regulator? Let me come to you first, Una, and then I'll end with you, Charlie.
It's a really interesting question, isn't it? I've worked in various organisations involved in regulation for the best part of 30 years. And the one thing that I do know is that we're rarely at the top of the popularity stakes in any polling, and we're rarely very popular with the individuals that we regulate, the businesses that we regulate, the sectors that we regulate. But I do think it's really important that we all take some personal and professional pride in what we do, because what we do as regulators is important, and we're here for a reason. And it's almost always to do with safeguarding the public interest. And that's a really important and vital role. And a couple of other things I would say is that regulators are fairly frequently criticised around individual cases, during public inquiries, or just more generally. And I do think it's really important that we listen to that criticism, that we not be defensive, and that we always respond in an open and I think probably a transparent way. And then I guess finally, going back to the point I made at the very beginning, remembering our humanity and the humanity of those that we regulate, it's really important that we have compassion at the centre of everything that we do. And there isn't a binary choice between being compassionate and being effective and efficient. They can absolutely very often go hand in hand.
Wonderful. Goodness me. Well, I hope that those listening hear those words and act on them, because I agree with them wholeheartedly. How about you, Charlie? What tips would you give?
So perhaps just to reinforce a bit of what Una said, I mean, I would I'd focus on three things. Firstly, just recognizing that the world of regulation, as with the world at large, lives in a state of constant change and evolution, and I think we need to embrace that, understand it, work with it. Secondly, I would say that all of us that work within regulation should be ambitious about the role that we can play in driving value. And I think we need to be, probably more so than ever at the moment, confident and clear about the benefits that regulation can bring. And finally, I would say to everybody, do you understand the role that you have within a wider system? So whilst obviously we all need to be clear about our core role, we should also be thinking about our softer power and the influence that we can bear to improve whatever it is in the sector that we work within. In our world, that's all about patient care, but there'll be equivalents for other colleagues listening to this podcast today.
Fantastic. Thank you very much, both of you. Again, I share those sentiments, and indeed, that's what's kept me working in regulation for the past 2.5 decades, is to try to strike those balances and to deal fairly with all interested parties. And as you say, in your case, to ensure there's patient safety and an effective health system for the country. It's really important work you're doing, and I wish you well. Thank you very much for joining us today. Keep up the good work. That's Charlie Massey and Una Lane from the General Medical Council. Thanks also to our sound engineer, Neil Bowerman from Bowerman Audio Productions. And I hope those of you listening have found this discussion interesting. Please let your colleagues know and share a link. Tune into future episodes where we'll discuss other issues of relevance to regulators today. And there's more material, events and training on the Institute of Regulation's website, ioregulation.org. That's it from the Regulation Podcast with me, Marcial Boo, from the Institute of Regulation. Good luck with your own regulatory challenges, and do stay in touch to help UK regulation become the best it can. Goodbye.